San Diego, we've really been thinking about what is it that we can do to sort of extend testing to the San Diego region.
And there may be an easier way to test groups of people at once for COVID-19, all while saving vital testing supplies during a nationwide shortage. Our ABC 10 News reporter Mimi Alcala explains how pool testing is working at UCSD Health and what it could mean moving forward.
Pooling is absolutely a strategy, for example, that employers could use on their employees, that universities, for example, can use on their students.
And that pool testing strategy is now being used at UCSD Health. As the nation faces yet another COVID-19 testing supply shortage, this could be one solution to conserving the current supply.
Pool testing works by taking a group of individuals and placing all of their specimens together.
The CDC says pool testing should only be used when the positivity rate is low enough. Dr. David Pride is the Associate Director of Microbiology at UCSD Health. He says instead of using one test per person, samples from several people are collected and tested together.
If that pool tests negative, then you can call each individual that was in that pool negative.
If the pool tests positive, then each person must be retested individually.
We test a lot of different patient populations, so we know what the prevalence of disease is in those patient populations, and we've chosen to use those with the lowest prevalence of disease for our pool testing.
They're currently using a 5-to-1 strategy, 5 people per one test, and so far the pooling is working exactly as expected.
We've done probably somewhere around 500 to 600 so far. We've had less than 10% of the pools test positive.
Pretty soon, Pride expects to start doing more pool testing while also speeding up the process.
Right now, we're really working on it in a very manual fashion, and that takes a lot of time to do. So we're in the process of, in essence, automating it by bringing in machinery to do that work that people are doing right now.
Mimi Alcala, ABC 10 News.
And Dr. Pride says UCSD submitted its emergency use authorization request to the FDA just a few weeks ago and expects approval very soon. He said the FDA has given positive feedback about the pool testing.